It's right here, right off of his shin on the inside of his knee. What's up again, everybody? It's Ben from LPI Physical Therapy, here today with a knee pain case, an inner knee pain case, specifically a pes anserine bursitis. Today we have Joe, and Joe is an avid runner. He didn't used to be, but he decided to train for a marathon this year, and so he's been increasing his mileage week after week. He's been running a ton over the last 6 months, and he's preparing for a marathon in November. And so lately he's been developing this pain right here on the inside of the knee, and it's very specifically right here. It's not inside of the joint, it's not on the kneecap, it's right here, right off of his shin on the inside of his knee. And so he went to get a scan and he got an MRI from his orthopedist. His orthopedist diagnosed it as pes anserine bursitis. So what is that? Pes anserine bursitis is just inflammation of the bursa on this little area. So you have a bursa sac right here, and you have 3 tendons that attach. You have a semitendinosus, which is your inner hamstring. You have a gracilis, which is one of your adductors, and you have a sartorius muscle that also goes into this piece. So which one is it that's causing that bursitis? Let's dive into that a little bit today. First, let's take a look at how Joe walks, and walking will give us a good representation of how he might also choose to run. In watching Joe walk, you can see how on his right side, his leg can turn in appropriately, but on his left side, his entire leg tends to stay turned out. He never fully turns in. So that already is giving us clues as to what's going on. So we ended up testing him on the table. And on the table, what did we find? We found that we can adduct his right leg, but we couldn't adduct his left one. So that's telling us that the position of his pelvis is such that his left innominate is forward in space, which doesn't allow us to bring this leg around, because these 2 bones right here will abut on each other. If the pelvis is in a posteriorly rotated position, I bring the leg around and those bones clear, and I can get that leg down. What does that mean? So out of the 3 tendons that attach to that area, we have a semitendinosus, and this is one of your hamstring muscles. It goes from the back of this sit bone down the back of the thigh, and it inserts onto the inside of this knee. So at the knee, what it will do is it will bend the knee and it will turn the knee inwards. But at the pelvis, what it does is it helps to rotate this pelvis inward as we walk over a leg. So if this pelvis doesn't know how to change shape, then we're not getting true internal rotation of this thigh, and we could be having overstretching issues that are causing tugging of that tendon at his knee and subsequently causing his pain. So we did a few more tests just to rule in if it was that semitendinosus, and it was. So we started with this exercise to bias the left hamstring, particularly an inner or medial hamstring. So we're gonna have Joe here on a couple yoga blocks. He's gonna go ahead and bridge himself up into that position, but he's gonna bias just the left side extending. So now he's gonna lift himself up here. He's gonna create that posterior tilt. He's not gonna lean back so much. He's using a right quad to reach a right pelvis forward. I'm gonna ask him to reach that knee forward as well. So now it's turning the pelvis. And effectively, we're biasing a left inner hamstring that's not only posteriorly rotating the pelvis, but also turning the pelvis to the left. And he's gonna breathe here for 5 breaths, and we're gonna take a break. So after those 5 breaths, effectively what we're doing is we're hacking into our nervous system, exhaling fully to release tension, inhaling to decompress areas that have been compressed for too long, and after doing that for a few sets, we retest him on the table, and that hip knows how to adduct, because now that pelvis can posteriorly rotate. So now he actually has access to that inner hamstring. Now that he has access to that inner hamstring, we're gonna start to train it a bit more. So after we were able to get Joe to adduct his leg by changing the position of his pelvis, now we need to start to train or shorten that inner hamstring to do 2 things: to help with the rotation of the pelvis, but also help with the rotation of the thigh in concert with our anterior glute med, another internal rotator, as we get over that leg and start to push off of it. Okay, he's gonna put this leg up at the level of his hip, and first we want to make sure we're biasing a pelvis that turns to the left. So I'm gonna ask him to push this right knee down into the ground, and it's gonna get a glute max to turn his sacrum over to the left. So now we're biased there. And now he's gonna activate this left hamstring by pushing against this box. He's gonna feel his hamstring engaged and his right glute. You feel those things? Maintaining those 2 things, he's now gonna start to lift that ankle up towards the ceiling. So now we're using an inner hamstring with an anterior glute med and a right glute max, all in concert together. So we're retraining, not only turning the pelvis to the left, but also appropriately turning the thigh bone inward as well. Every time we walk or get over that leg, we're getting ready to push off that leg. Both the pelvis and the thigh bone need to be able to turn in or create internal rotation appropriately so that we can start to push off of that leg and get over to the other side. Simply doing those 2 things, we were able to get Joe's pain down to 0 out of 10 within the first session. By no means is that the end of his plan of care. He he is an avid runner, he's gonna need a lot of stability on that leg. Will need to progress to standing positions, single leg dynamic positions, and his entire plan of care will likely last close to 2 to 3 months. If you have a friend who's been dealing with that inner knee pain, some pes anserine bursitis, they don't know how to treat it, tag them below, let them know that we have the answers for you. Thanks for tuning in.